Calls tonight for an independent investigation following the death of a Quebec man after a horrific stay in the ER led him to request medical assistance in dying. David Gentile takes us through the man's experience.
Okay.
For the last 2 years, Sylvie Brosseau cared day and night for her partner Normand Meunier. His arms and legs were paralyzed in 2022.
Okay, do.
But it was a trip to a Quebec hospital that ultimately led him to choose a medically assisted death. In January, Meunier was admitted to Saint-Jérôme's ER for a severe infection.
95 heures à l'urgence sur une civière. Inacceptable.
For 4 days, he was stuck on a stretcher with a firm mattress. But he needed a therapeutic mattress that shifts pressure points on its own to avoid sores developing. Brosseau asked for one repeatedly.
Mais le matelas arrive jamais. Jamais, jamais, jamais.
Overwhelmed staff also never moved him themselves. He developed a gaping bedsore, so bad muscle and bone were exposed. Treatments did not work.
Mon médecin, il est venu me voir et il dit l'infection est rendue dans tes os.
His doctors told him they could not save his life. Facing a slow, agonizing death, he asked to receive medical assistance in dying and was accepted.
It's pure neglect. It's the only word that comes to mind.
This advocate for people with disabilities fears people are turning to medical assistance in dying because of the lack of proper care.
It is becoming an alternative to decent care, and the numbers will explode because it's there. And this case of Mr. Meunier will put that in light.
The local health authority says it has 140 mattresses with alternating pressure. An internal investigation is now underway to figure out why Meunier couldn't get one. Facing his death, Meunier told us he did not want to be a burden.
Moi, je veux être capable de prendre Sylvie dans mes bras.
He died at home the following day, surrounded by his loved ones. Experts say tragic stories like this need to be a wake-up call.
Excuse-moi.
David Gentile, CBC News, Montreal.
Quebec's health minister says that this case is completely unacceptable. Christian Dubé says that they'll start with an internal investigation, but he's open to an independent investigation if warranted. For more now, we're joined by Dr. Sonu Gand. He's a professor in the Faculty of Medicine at the University of Toronto. He's also a former physician chair of the Humber River Hospital MAID team. He joins us from Toronto tonight. Thank you for being here. First, I want to get your thoughts on this story that we just played.
Well, look, I mean, I think your heart has to go out for Monsieur Meunier. It is a tragic story. And it is something where it, unfortunately, I think, reflects some of the problems that we're seeing, not just with our healthcare system, but also with the very expansive MAID or assisted dying laws that we now have that sometimes make it easier to die than to be given a chance to live with dignity.
The story also highlights, the declining healthcare system in this country, which many say is declining. Do you think that this story tells us less about MAID and more about the way healthcare works in Canada?
I actually think that there are two sides of the same coin. That on the one hand, what we know from the reports of what happened with Monsieur Meunier is that he had over 90 hours in the emergency room without being able to be turned properly or get the pressure mattress that he needed. So of course that speaks to our healthcare system and the strains on it. But at the same time, what was then the other side of that coin? The other side of that coin was that our same society that wasn't able to get him a proper mattress or turn him in all that time also comes to him and says, well, we can provide you a quicker and easier death if that's what you now wish. And there's no indication that he was seeking death until he developed these sores as a consequence.
In 2022 alone, 13,241 MAID provisions were made, making up 4.1% of all deaths in Canada. What's your reaction to the growth of MAID in recent years?
Well, Canada has had some form of MAID laws since only 2016. That's less than a decade. And that explosive growth in that time to over 13,000 in 2022, over 4% of all deaths. No other country on the planet that has assisted dying laws has seen that rate of growth. Countries that have had assisted dying for decades have not seen that rate of growth. All accounts are that for 2023, it'll be even higher. We're estimating it'll be about 16,000, maybe more. That approaches 5% of all Canadian deaths. And within that, there are some significant troubling signs. And I should say that I point this out not as a conscientious objector. As your intro pointed out, I was chair of my former hospital's MAID team.
Right.
But I have seen, along with my colleagues, the disturbing trends that our expansions are leading some people to seek death for. And in that number of 13,000, over 13,000 that you cited, about a third of those people said that feeling a burden was one of the sources of suffering, leading them to seek MAID, just like Mr. Meunier did.
So give me some specifics in terms of situations where you don't think MAID should be applicable.
Let's rewind for a second, because what we've been told and promised as a society is that MAID is something we're offering compassionate relief from suffering for. Compassionate relief from suffering from a medical illness that will not get better. What we've seen as we've expanded the laws further and further from 2021 onwards is that there are people who are in marginalized populations they have a medical condition, but what's actually driving their suffering is poverty, social isolation, not being able to get adequate care, etc. So that is highly problematic to me. And I think most Canadians, when they realize that's happening, would wonder why we're providing MAID in some of these cases.
Let me just ask you two quick questions here before we go. One, what reforms, if any, you'd like to see with how the MAID system currently works in this country? And also on this specific story, how do we prevent something like that from happening again?
So I think one area that people don't realize is the extreme degree of leeway that MAID assessors have in deciding whether they, in their subjective judgment, think somebody should qualify or not. Working on a MAID team, I know that most of my colleagues work diligently and are very thorough. But at the same time, those are not safeguards. And we have had some very prominent MAID providers who've provided over several hundred MAID deaths themselves say that they would consider someone eligible for MAID if they were on a long enough wait list for treatment that could help. Think about what that means, that there's treatment that could help. Our system may not have the opportunity to offer it quickly enough. And some MAID assessors would say, we think that qualifies you for MAID. So I think one thing that needs to happen is we need to tighten up and have better standards and actual safeguards that assessors need to adhere to. And we also have not been properly reporting and tracking the causes of true suffering that marginalized populations might be seeking MAID for. And if that were to happen, it was supposed to be reported in 2022, but we didn't see any change in those reporting statistics. Hopefully moving forward, we'll see some things like that show us what some of the more vulnerable populations are actually seeking MAID for. Because it is not just one thing. When people seek it to relieve life suffering that maybe society should help with in different ways, most Canadians, I think, would be concerned about that.
Doctor, appreciate your time and your perspective on this story tonight. That is Dr. Sonu Gand, a professor in the Faculty of Medicine at the University of Toronto.